We also have pre-op exercises for you. I'm going to show you how to do those now. When you do the exercises, lay flat, put a pillow under your head for support. These exercises are designed to overall get your legs strong before your surgery. And we also recommend do both legs before your surgery. That way both legs will be strengthened up for you. And if any of the exercises give you any pain or discomfort, either back off the number of repetitions, or if you need to, you skip that particular exercise altogether. You may find you're not able to do every single exercise before your surgery, and that's okay. The first exercise is an ankle pump. It's exactly what it sounds like. You're just pumping your foot back and forth. This will help prevent blood clots. This will help get the swelling out of your leg. And it also strengthens the muscles that help to pull your toes up as you walk, which helps prevent falls. The second exercise is called a quad set. Now your quad muscle is your thigh muscle. All you're doing is laying flat and you're pressing the backs of your knees down into the bed. You'll feel your thigh muscle tighten up. You just hold that muscle tight for a count of 5 and relax. The third exercise is called a glute set. Now your glutes are also your bottom muscles. All right, so we call this one a butt squeeze also. When you do this exercise, you're just pinching your cheeks together. You'll feel your bottom muscles tighten up. Hold for a count of 5 and relax. The fourth exercise is called hip abduction. Hip abduction is bringing your leg out to the side. When you do this one, have that leg straight, toe pointed up and down. Bring your leg out to the side and then you bring it in. The fifth exercise is called a straight leg raise. When you do this exercise, bend the knee that you're not going to be lifting. That's going to help to save your back. And then you're going to lift that other leg straight up off the bed. Make sure it's straight, and you don't have to lift it up any higher than the level of your opposite knee. You bring it up, hold for a count, and then you can bring it down. The next exercise is called a heel slide. Again, you're laying flat and you're just going to slide your heel back towards your bottom as far as you can. That's going to help to strengthen the muscles behind your leg. And then you slide it out straight. And then the last two exercises, the first one is called armchair push-ups. Now, armchair push-ups, you want to sit in a chair, preferably with arms, have your feet flat on the floor, and you're going to practice the motion of leaning forward to stand up as if there was a walker in front of you and you were standing up to the walker. You do not need to lift your whole body up off the chair. You just push with your arms and do a half stand. If you don't have a chair with arms, you can do this one without the arms, and that'll be okay. But try to use one with arms if you have it. And then the last exercise is called standing heel and toe raises. Do this one at a sink, a counter, a table, somewhere where you can put your hands up for support. You want to stand nice and tall. You're going to go up on your toes, hold for a count, and come down. And then the other half of that exercise is going back on your heels and pulling your toes up. And that group of exercises should help you to get strong prior to your surgery so you get a better recovery. And it does make a difference. The pre-op exercises are very important when it comes to your recovery.